Good morning, Saunders County. It's Dr. Akers here to give you another update. I know we're entering another week of dealing with the coronavirus pandemic, and as I am feeling, I'm sure many of you are also feeling just the anxiety and the anticipation of waiting for where is the future taking us? Is this going to continue on for much longer? When can we get back to our normal routine? And I want to reassure you that we are all feeling that same way. It is a very normal response to have some stress and anxiety regarding the future because it's uncharted territory and we don't know what the future holds. But I do want to emphasize to you how important continuing the social distancing truly is. We are anticipating within the next 2 weeks per President Trump that's when we'll see the peak across the country. Now, Nebraska may be a little bit more of a lag behind that, and it may take even longer, but that's our anticipated timeline. So now is when it's really key to try and stick to that social distancing and trying to minimize your social interactions as much as possible. And we really appreciate your adherence to doing that. The other topic I wanted to discuss with you today is how to talk to your children about coronavirus. I think as a mother, as well as a provider that takes care of a lot of children, I do see a lot of stress and anxiety coming from our children because of the unknown. So I actually found on the CDC website some very useful tips that you can use to talk to your children. The first one being remain calm. If you're showing a lot of stress and anxiety to your children, they are also going to sense that stress. And make sure that you have time to talk to them, whether if you are still working, when you get home from work, around the dinner table, or in the evening time when you're tucking them into bed. Ask them what they have heard about coronavirus, what their fears are, so that you can have an open line of communication. You want to avoid language that blames others. We do know that this virus started in China, but it could have started anywhere. So I think just being open and understanding that this virus doesn't pick a certain sex, it doesn't pick a certain race, doesn't pick a certain ethnicity, it impacts us all. So trying to be very open about that. One tip that they recommend, which I do think is quite useful as well, is to minimize the screen time with regards to the COVID-19 coverage. I know that we're using a lot of screen time right now because of school being out, having to do assignments online, or needing to, when you're in social isolation, you need to have some form of entertainment. So I understand, and I think the timeline for our 2 hours of screen time per day, it needs to be flexible right now. But I do think that making sure we minimize the amount of coverage regarding the pandemic in a child that's still growing and may not fully understand it will help minimize their stress level. Be honest with them too. Tell them what the symptoms are that we're looking for. So if they're outside going on a walk and one of their friends tries to come and hug them or play a game with them, they understand why we are recommending that they don't have play dates or minimize their social interactions as much as possible. So I think just being honest with them about how the virus is spread, what it can cause, and that you will tell them if someone they know or love gets sick, they will feel a lot less scared that things are being hidden from them. So again, just that open line of communication at an age-appropriate level is what's recommended from the CDC. And it's a really great opportunity to practice hand washing, turning on a song, listening to the ABCs or the happy birthday song, something that can be fun for them. That's something that in general is really important to stress and emphasize to your children, whenever we're talking about hand washing, flu season, but especially right now, it's a good time to really reinforce those good habits. So if you have any questions regarding how to speak to your child, I encourage you to look to the CDC website. Again, they have a really great resource for different tips that you can use, but just remember that we will get through this. Patience is the key. Every day things are changing. Every hour it feels like things are changing. So we are right there with you, learning as quickly as we can to make sure that we're keeping you as safe and healthy as you can. Stay healthy.